Welcome to today's Explainer. Today we're embarking on a truly fascinating journey together. We're going to completely demystify the world of nursing research. We'll be tracing the incredible path of how a simple, everyday observation made right at the patient's bedside travels through rigorous scientific testing and ultimately transforms into life-saving protocols that just elevate healthcare for everyone. So if you've ever wondered how healthcare actually moves forward and improves, you are in exactly the right place.
Okay, let's dive right into this. Nisiodomi and Bailey actually remind us that research isn't just some abstract theory happening in a dusty laboratory somewhere. No, it's the absolute, vital backbone of providing the best possible patient care. Think about it, without evidence, we're really just guessing. And when it comes to human lives, guessing simply isn't good enough.
So here is our roadmap for the explainer today. We've got 6 steps. 1. Identifying the problem. 2. Reviewing the literature. 3. Establishing social value. 4. Selecting methodology. 5. Presenting results. And finally, 6. Implications to practice. Let's see how this whole process builds, step by step.
All right, starting off with step 1, identifying the problem. This is where the journey begins.
You can think of a new clinical inquiry a lot like a giant vertical leap. And bedside nurses, well, you are perfectly positioned to spot these critical issues because you're the ones interacting with patients every single day. Let's say you notice a reoccurring issue, like patients shivering uncontrollably during and after surgery, which is known as intraoperative hypothermia. Just asking if there's a way to prevent that chilling provides this crucial initial momentum for scientific inquiry. The whole thing literally starts with a real-world observation.
So where exactly do these research questions come from? Now, while personal clinical experience is a massive motivator, for sure, it's not the only one. Digging into existing theories and actually replicating previous studies are equally vital sources for identifying solid research problems. Repeating those older studies is what helps us build a cumulative, truly trustworthy body of knowledge. But here's the catch. We have to be really careful about how we ask our questions. We can't test values or ethics. Like, we can't test should patients have unlimited visitors because, well, that's a value judgment, right? Instead, we turn it into a highly specific, empirically testable question. Something like, is there a difference in patient anxiety between restricted and unlimited visiting hours? See the difference? We move from a broad opinion to something we can actually measure.
Moving right along to step 2, reviewing the literature. This is all about building the foundation.
Now, what's really interesting about this phase is that integrating theoretical frameworks is the absolute bedrock of a study. A thorough literature review ensures we aren't just out there reinventing the wheel. It helps us figure out what's already known, what theories apply, and honestly, most importantly, it pinpoints the critical gaps in our current knowledge. Those are the gaps our new study is gonna fill.
And we don't just read old studies, we critically analyze and synthesize them. Bringing all these disparate, independent studies together helps clinicians judge if the existing knowledge base is actually solid enough to use on the hospital floor right now, or if we desperately need more research before making a move.
Which brings us to step 3, establishing social value. Why does this actually matter to humanity?
Before we ever measure value in dollars or efficiency, we absolutely have to measure it in human ethics. The ethical aspects of a study and the strict protection of the participants must always take absolute precedence over everything else. Literally, if it isn't ethical, it simply cannot happen. No exceptions.
So assuming the study is ethical, we then look at its contribution to evidence-based nursing practice, or EBNP. Basically, this means merging the best research evidence with your clinical expertise and, of course, the patient's own preferences. Proving the social value and the cost-effectiveness of this care is exactly what ensures the credibility, the accountability, and, honestly, the entire future of the nursing profession.
All right, step 4, selecting methodology. Time to choose the exact right tools for the job.
It's kind of the golden rule in research. The research question itself has to dictate the methodology. We never, ever want to take a researcher's favorite method and try to awkwardly shoehorn a question to fit it. The problem always drives the tool we use.
Generally speaking, those tools fall into 2 main camps. On one side, you've got quantitative research. That's the rigid, numbers-driven science of epidemiology, requiring super tight controls and empirical data. Then on the flip side, there's qualitative research. This is the more nuanced, patient-focused art of understanding subjective human experiences right in their natural settings. And the truth is, both are absolutely essential if we want a complete picture of healthcare.
Okay, on to step 5, presenting results. This is where we share the truth we've uncovered.
Because gathering all that empirical data, well, it just isn't enough on its own. If you do all this incredible research and then just keep it to yourself, it has zero impact. We have to communicate these findings accurately and widely through peer-reviewed journals and professional conferences if we want to actually change minds and shift policies.
And this brilliantly illustrates a point made decades ago. Back in 1978, researchers Pollitt and Hungler put out a critical warning in their textbook that, honestly, still holds up perfectly today.
They warned that statistical significance does not necessarily equal clinical significance. Think about it. You could have a statistically perfect, pristine result from your data analysis, but it might still be practically useless on the hospital floor if it doesn't actually improve patient comfort, health, or efficiency. At the end of the day, those numbers must translate into real-world care.
And finally, step 6, implications to practice, bringing it all back to the bedside.
This is the moment where research finally leaves the academic journals. But remember, all the research in the world is entirely useless if we just ignore it and keep providing nursing care, quote-unquote, the way we've always done it. We absolutely have to be willing to evolve.
So how do we actually evolve? Well, a bedside nurse evaluates the published findings, they work to overcome those stubborn barriers to implementation, they actively adopt these new evidence-based interventions, and ultimately they achieve the main goal, improving patient outcomes. Literally, this is exactly how outdated hospital protocols get changed for the better.
To show you just how powerful this is, Melnick calls this the "so what" factor of research. Take the COPE intervention, for example. By simply empowering the parents of premature infants through a carefully researched protocol, they proved these tiny babies could be discharged 4 days sooner. To put that into perspective, if implemented widely, this single research finding could save the U.S. healthcare system $2.5 billion annually. No way, right? But that is the ultimate so what factor in action.
We've just seen how a simple, everyday observation travels through theory, ethics, and strict methodology to become a protocol that literally saves lives and billions of dollars. So, my question for you is, what observation will you make today that could change nursing practice tomorrow? Remember, your own clinical environment is this incredible landscape of potential, life-saving discoveries. Thank you so much for joining me on this explainer, and keep asking those great questions.